things that we should make the government confident that the people are with them. So that is why we are encouraged to invite you as a doctor also. We are very fortunate that you are a very famous eye specialist and your word carries a lot of weight when you talk to the doctors as well as medical students. Medical students, they are busy in Ganesh Chaturthi Puja. So we are having very less students, otherwise we would be expecting the full hall. So with those words, I invite Dr. Rajiv Gupta, our member organizing committee as well as medical superintendent AIIMS, to deliver the welcome address. Dr. Rajiv Gupta, please.
Thank you, Dr. Mitul. It's a great honor, and I feel with nostalgia that we have amongst ourselves Dr. Baljeet Kaur, Cabinet Minister, Women and Child Development, which is a very crucial portfolio. Our respected worthy director, sir, Dr. D.K. Singh, organizing committee member, Dr. Noria, my colleague, Dr. Shiba, Dr. Rohit, faculty from AIIMS, and dear students. I extend a very warm welcome to you all. See, these events are very important in our career. And since I joined, I was listening, I was in Ludhiana and I was listening to a Mapicon. Every year it happened for the last 10 years, and Shiva is a regular participant in that. I used to think that Apicon is the biggest thing, but by organizing this Mapicon, I must say that it's bigger than Apicon. Dr. Bitul and his team, under the direction of our director, sir, has created a real thing for Bathinda, with AIIMS being the participant host. And I'm sure this is the 4th day, and it's a feast to listen to a diverse range of views. And I was talking to my students, they are greatly benefited by this conference. And with the presence of our Honorable Cabinet Minister, I'm sure she is going to guide us, she is going to share her views, because women and child development is very close to her heart, and the way that this government is working is helping in many ways with Mohalla clinics. Definitely, as a practitioner, they have affected the practice of many doctors who are doing private practice, and that's a first-hand knowledge, ma'am. And that's a very great effort, because what director says tells us that, like AIIMS being in the center of all these events, because in this part there was no other health institutions. We during COVID also we realized AIIMS has done a good work. AIIMS during COVID period, if I tell you, after PGI, we have operated maximum number of mucor cases. That also, we didn't have that time functional OTs. Sir has created those OTs with his experience in the OPD block. So after PGI, we have a maximum number of COVID patients which were operated by Dr. Vaibhav Saini from ENT department. That's a great achievement under Sir's command. And I was listening to him. He was telling me there's a lot of, before starting my surgical practice here, there was a lot of time, and still I spend a lot of time with him as an administrator, and there is a lot to learn from him. Ma'am, the department which you are heading is very close to his heart. He wants to develop, because if I say that we are standing in AIIMS Bathinda, if we look around at 150 kilometers around this area, there is no other good institutions. 150 kilometer away, Dayanand Medical College is there. Another 200 to 50 kilometer away, PGI is there. So we are in the center of that hub, where people are poor, and like women and child health department is close to your heart. Our director sir's vision is that we should develop AIIMS as a hub for women and child development. And we need support from you. We need support from being a central hospital. I know there is a lot of party, but what we believe, what directors believe is health and education we should keep apart. We need your help in making AIIMS as a hub for women and child development department. I'm sure you are going to help us. Another thing, as a host, I should not demand from you that there is a lot of workforce, that nursing staff, like our doctors, 80% of nursing staff is women. And they are married, they have kids, they need to take care of the kids. We need and we seek your support for their small kids, because they're like, AIIMS is a national facility and they come from different states, and it's our duty from Punjab, and being a Punjabi, I request you to take care of them. So I request you that you help us in developing like preschool learning in AIIMS campus or crash type facility, where they can leave their kids without any worries, because domestic help is difficult to get. We get from nearby villages. So it's as your department is there, I'm sure you are going to give us a big hand, and we need to develop this. And I'm keep on demanding, so I'll keep myself to the limit. I again extend a very warm and hearty welcome to you, ma'am, and to the other dignitaries. Thank you very much.
Thank you, sir.